clinical decision support, and patient safety. Clinical decision support systems, CDSS, play a vital role in enhancing patient safety by assisting healthcare providers in making informed decisions that minimize risks and improve care outcomes. By leveraging real-time data, evidence-based guidelines, and advanced analytics, CDSS can help prevent medication errors, detect clinical deterioration early, and reduce diagnostic errors. Here's how CDSS contributes to patient safety in these key areas. 1. How CDSS helps prevent medication errors and adverse drug events, ADEs, drug-drug interaction. Alerts. CDSS helps prevent adverse drug events, ADEs, by warning clinicians about potentially harmful drug interactions. These interactions can result in serious patient harm, including changes in drug metabolism, toxicity, or diminished efficacy. By flagging these interactions in real time, CDSS ensures that healthcare providers are aware of the risks before prescribing or administering medications. Example: if a physician orders an antibiotic that interacts with a patient's current heart medication, the CDSS will alert the physician, prompting them to adjust the treatment plan and avoid potential complications like arrhythmias or reduced antibiotic efficacy. Allergy alerts. CDSS can prevent medication-related allergic reactions by flagging potential allergens based on the patient's medical history. These alerts ensure that medications, vaccines, or contrast agents that a patient is allergic to are not prescribed, reducing the risk of anaphylaxis or other severe allergic responses. Example: if a patient is known to be allergic to penicillin, the CDSS will notify the prescribing physician to avoid penicillin-based antibiotics and suggest safe alternatives. Dosage and administration alerts. CDSS can identify potential errors in medication dosages, particularly in high-risk scenarios such as pediatric care or renal impairment. It alerts clinicians if the prescribed dose falls outside safe limits or conflicts with patient-specific factors, e.g., age, weight, kidney function. Example: a CDSS may alert a healthcare provider if the prescribed dose of a medication is too high for a pediatric patient or if the dose needs adjustment based on the patient's renal function, reducing the risk of overdose or toxicity. Medication reconciliation. CDSS can assist in the process of medication reconciliation, helping to identify discrepancies between a patient's prescribed and reported medications. This is particularly important during transitions of care, e.g., admission, discharge, or transfer, where medication errors are more likely to occur. Example: if a patient's discharge medications don't align with their hospital medication list, the CDSS can alert the clinician to review and correct the discrepancy, preventing medication errors after discharge. 2. Enhancing patient safety with early detection of clinical deterioration. Vital sign, monitoring and alerts. CDSS can continuously monitor vital signs, laboratory results, and other clinical parameters to detect early signs of patient deterioration. When a patient's condition shows signs of worsening, the system triggers alerts to notify healthcare providers of the need for immediate intervention. Example: if a patient's heart rate increases or oxygen saturation drops significantly, the CDSS can issue an alert, prompting healthcare professionals to reassess the patient's condition, perform further tests, or administer appropriate interventions like oxygen therapy or fluids. Sepsis detection. One of the most crucial applications of CDSS is its ability to detect early signs of sepsis, a life-threatening condition that can cause rapid organ failure and death if not treated promptly. By analyzing clinical data, CDSS can identify patterns indicative of sepsis and alert clinicians before the condition progresses to severe stages. Example: if a patient's temperature rises, heart rate accelerates, and white blood cell count increases, the CDSS will generate a sepsis alert, enabling early administration of antibiotics and fluids to prevent organ failure and death. Predictive analytics for deterioration. By analyzing patient data over time, CDSS can use predictive analytics to identify patients at high risk of clinical deterioration. These systems take into account various clinical parameters and patient demographics to anticipate changes in a patient's condition and trigger early alerts for intervention. Example: a CDSS might predict a risk for post-operative complications such as deep vein thrombosis or respiratory failure in a patient with multiple comorbidities, prompting preventive actions such as prophylactic anticoagulation or close monitoring. Continuous monitoring of high-risk patients. CDSS can track and assess patients in high-risk categories, such as those in the intensive care unit, ICU, and provide real-time updates on their clinical status. This helps clinicians make decisions based on up-to-the-minute data, improving their ability to react promptly to any signs of deterioration. Example: in ICU settings, a CDSS may continuously monitor patients for subtle changes in oxygenation, respiratory rate, and blood pressure, issuing alerts if any of these parameters move outside the established thresholds. 3. Reducing diagnostic errors through decision support and data analytics. Guideline-based decision support. CDSS assists healthcare providers by offering evidence-based diagnostic recommendations based on clinical guidelines and patient data. This helps reduce diagnostic errors by guiding clinicians to consider all relevant possibilities and avoid cognitive biases. Example: a CDSS might prompt a physician to consider a rare condition, such as pheochromocytoma, when a patient presents with symptoms like hypertension and headaches, ensuring that the physician doesn't miss a critical diagnosis. Clinical pathway integration. CDSS can integrate clinical pathways into the diagnostic process, prompting clinicians to follow standardized procedures for diagnosing and treating specific conditions. This ensures that best practices are followed, minimizing the likelihood of errors due to incomplete or inconsistent evaluations. Example: when a patient presents with chest pain, the CDSS may recommend a structured workup for myocardial infarction, MI, including an electrocardiogram, ECG, cardiac biomarkers, and imaging, helping to rule out MI and avoid misdiagnosis. Support for differential diagnosis. CDSS can provide clinicians with differential diagnosis options based on patient symptoms, medical history, and laboratory results. This is particularly helpful in complex cases where multiple conditions may present with similar symptoms, reducing the likelihood of diagnostic mistakes. Example: if a patient presents with fever, cough, and shortness of breath, the CDSS might suggest a differential diagnosis of pneumonia, COVID-19, or asthma exacerbation, guiding the clinician to consider all possible causes before making a diagnosis. Clinical decision support algorithms. CDSS uses advanced algorithms to analyze patient data and provide real-time data-driven insights that can support clinical decision-making. These algorithms can detect patterns that may not be immediately apparent to clinicians, helping them identify conditions early and avoid errors in diagnosis. Example: a CDSS might analyze a patient's lab results, medical history, and physical examination findings to identify early-stage kidney disease, prompting the clinician to initiate further testing and management before the condition worsens. Reducing cognitive overload. By automating routine decision-making tasks and presenting relevant clinical data at the right time, CDSS helps reduce cognitive overload, which can lead to errors in diagnosis. When clinicians are not overwhelmed with irrelevant or excessive information, they can focus on the most important aspects of patient care. Example: a CDSS might present only the most critical lab results, such as abnormal liver function tests or elevated potassium levels, to the clinician, allowing them to prioritize actions and decisions based on the most pressing issues. Legal, ethical, and regulatory considerations in clinical decision support systems, CDSS. The integration of clinical decision support systems, CDSS, into healthcare workflows brings about numerous legal, ethical, and regulatory considerations. These considerations are crucial to ensure that CDSS is used responsibly within the boundaries of law and in a way that respects patient rights while optimizing clinical outcomes. 1. Compliance with healthcare regulations, HIPAA, FDA, etc. HIPAA, Health Insurance Portability and Accountability Act. In the U.S., CDSS must comply with HIPAA regulations to ensure patient privacy and data security. HIPAA sets standards for the protection of health information, and any CDSS that handles patient data must safeguard that data from unauthorized access, disclosure, or misuse. Compliance requirements. CDSS must implement robust data encryption, secure user authentication, and proper data handling procedures to ensure compliance with HIPAA's privacy and security rules. Providers must ensure that patient data is shared and stored only in a secure manner and that access is limited to authorized personnel. FDA, Food and Drug Administration. In the U.S., the FDA regulates certain types of software that can be classified as medical devices. If a CDSS is used to support or guide treatment decisions, particularly those that impact patient outcomes, it may be subject to FDA approval, particularly if it involves diagnostic or therapeutic recommendations. Classification. The FDA classifies CDSS tools as software as a medical device, SAMD, if they directly influence clinical decisions. For example, a CDSS that assists in diagnosing diseases based on patient data might be considered a medical device and require FDA approval before being used in clinical practice. FDA approval process. The system would need to undergo rigorous testing for safety and efficacy. If a CDSS is not classified as a medical device but is intended to support clinical decisions, it might still need to adhere to certain FDA guidelines, especially if it provides drug recommendations or diagnosis suggestions. Data protection regulations, GDPR, etc. For healthcare providers operating outside of the U.S., compliance with data protection regulations, such as the General Data Protection Regulation, GDPR, in the EU, is essential. These regulations govern how patient data is collected, stored, and shared, ensuring patient privacy and informed consent. GDPR requirements. CDSS must ensure that patient consent is obtained for data usage, that data is anonymized where possible, and that patient rights to access, rectify, or delete their personal data are respected. 2. Ethical implications of using CDSS in decision-making. Patient autonomy. One of the key ethical considerations in CDSS implementation is respecting patient autonomy. Patients must have the right to make informed decisions about their care, and CDSS should not undermine that right. CDSS should serve as a tool to inform clinical decision-making, not replace the clinician's judgment or override the patient's choices. Transparency. Healthcare providers must explain to patients how CDSS is being used in their care, ensuring that they understand the role of technology in their treatment. While CDSS can provide valuable insights, it should be clear that the ultimate decision rests with the clinician, in collaboration with the patient. Bias in algorithms. CDSS relies heavily on algorithms that analyze patient data and suggest decisions. If these algorithms are based on biased or incomplete data, they may lead to inaccurate or unfair outcomes, potentially affecting certain populations disproportionately. Mitigating bias. It is crucial to regularly audit CDSS algorithms for biases, particularly in relation to race, gender, socioeconomic status, or medical history. Continuous updates to ensure algorithms are based on diverse and representative datasets can help mitigate this ethical issue. Informed consent for CDSS use. Patients must be made aware of the role of CDSS in their care, particularly when it influences diagnostic or treatment decisions. Ethical practice requires that healthcare professionals inform patients about how CDSS is integrated into their care and give them an opportunity to ask questions or opt out if desired. Patient education. Clinicians should provide patients with information on how the CDSS works and its potential benefits, as well as any limitations. While CDSS is designed to support clinical decisions, patients should understand that it is not infallible and is ultimately just one part of a comprehensive treatment plan. Data ownership and consent. Ethical concerns around data ownership are significant, as patient data is used to fuel the decision-making process in CDSS. Clear consent must be obtained regarding how patient data is utilized, stored, and shared, and patients should have the ability to revoke consent at any time. Data stewardship. Healthcare organizations must ensure that patient data is used ethically in accordance with legal regulations and for the sole purpose of improving patient care. 3. Managing liability and responsibility for clinical decisions, supported by CDSS liability for clinical decisions. The use of CDSS raises questions about liability in clinical decision-making. If a clinician follows a recommendation from a CDSS that leads to an adverse patient outcome, questions may arise about who is liable: the healthcare provider, the developer of the CDSS, or both. Clinician responsibility. Ultimately, the clinician is responsible for making the final decision regarding patient care. CDSS is a tool to support clinicians, but it is not a substitute for their clinical expertise. Clinicians must use their judgment when interpreting CDSS recommendations, considering patient context and other factors. Clear documentation. Healthcare providers should maintain clear documentation when using CDSS in clinical decision-making, outlining the rationale for following or disregarding the system's suggestions. This helps establish that the clinician took appropriate responsibility for decisions made. Developers' responsibility. Developers of CDSS tools are responsible for ensuring their systems are safe, accurate, and free from errors. They must also ensure that the system is regularly updated and tested for functionality and clinical validity. If a CDSS error leads to harm, the developers could be held liable, depending on the circumstances. Product liability. Developers must ensure that their systems adhere to relevant regulations, including medical device standards and data protection laws. They should also conduct robust testing and validation processes to ensure the system's recommendations are accurate and evidence-based. Defining liability in multi-party settings. In situations where multiple entities are involved, such as healthcare organizations, CDSS vendors, and clinical teams, the liability may need to be shared or apportioned based on specific roles and responsibilities. Contracts and agreements. Healthcare organizations and CDSS vendors should have clear contracts in place that define the responsibilities of each party. This can include outlining the roles of clinicians, developers, and healthcare providers in the event of a clinical error or adverse event linked to the use of the system. Malpractice and CDSS. If a clinician fails to use CDSS correctly or ignores critical alerts, they may be held accountable in malpractice lawsuits. Clinicians must be trained to use CDSS effectively, ensuring they do not rely solely on the system and continue to apply their clinical expertise to every decision. Best practices. Establishing best practice guidelines for integrating CDSS into clinical workflows can help reduce the risk of liability. This includes ensuring proper training, conducting regular reviews of system alerts, and encouraging critical thinking alongside the use of technology.